Let's talk about male rhinoplasty. Men have rhinoplasty or nose jobs for different reasons. Sometimes it's purely cosmetic. Oftentimes it's due to a nasal fracture and even nasal obstruction from a deviated nasal septum or a fractured nasal septum. I'm going to show you a few examples right now. This is a young gentleman who had a nasal fracture from a sporting related injury. The nasal bones are shifted to one side. He has a deviated septum with nasal obstruction, and even the lower two-thirds of the nose, which is mostly cartilage, is shifted to one side. I did a reduction of the nasal fracture as well as a rhinoplasty and a septoplasty, and you can see the nasal bones are centered, the bridge is narrowed, the tip has more definition, and the lower two-thirds of the nose, the cartilage part, is centered because he has a cartilage sputograft inserted in here to make sure that this stays straight. On this view, again, you can see that the nasal bones are centered appropriately. The lower two-thirds of the cartilage part of the nose is centered, and it's centered because a sputograft is put in here to take care of the collapse on one side. And he's breathing much better. Cosmetically, he was self-conscious about an over-projected bridge. The bridge drooped quite a bit when he smiled. We lowered the cartilage and the bone of the dorsum of his nose. The bridge is more appropriate for his facial features. The bridge is straight, it's strong, it's masculine, it fits his facial features more appropriately, and he breathes much better. He has a big smile on his face. He had an excellent result both cosmetically and functionally, and we reduced the nasal fracture. This is a good male rhinoplasty and a good reconstructive case and a good example of a male reconstructive nose surgery. Let's look at another example. This is another gentleman with a nasal fracture, a significant sporting injury causing the entire bridge to be shifted to one side. The nasal bones were centered. A cartilage sputograft was put into the collapsed side of his nose. His nose is now centered and he's breathing much better. The nasal bones are centered. The lower two-thirds of the nose is centered because of the sputograft, and we softened the bridge somewhat cosmetically. We lowered the bump, still maintaining a strong nasal masculine bridge. We softened the nasal tip a little bit. His facial features are now more balanced. The bridge is straight. There's less of a columellar show. He's very pleased with the results. He's breathing better, and he has a better result functionally and cosmetically. This next case is a good example of a man who simply had cosmetic concerns with his nose. He felt the bridge was too wide and he had a nasal bump. We lowered the bump of his nose, which you can see on the side view, and the nasal bones are narrower. On this view, he wanted me to reduce the bump or the nasal hump and give him a straight nasal bridge because it drooped too much when he smiled. Here he is post-operatively about a year later, a strong masculine bridge, a well-projected tip with no hump, no bump anymore, and he's very pleased cosmetically, and the results fit his face, and the rest of his facial features are in much better balance, and he's breathing much better. So these are different examples of a male rhinoplasty, both from a purely cosmetic point of view as well as a reconstructive point of view after nasal injuries. If you have any questions, feel free to give my office a call, and we'll be happy to help you out if we can.